Hello and welcome to Transition Survival 102. Today we're going to focus on assessment criteria, which we've talked a lot about, I think, in just do a quick reminder and then look at much more specific, broken down details of what the skills are that we're going to teach, and then also how to teach those in the best manner based on evidence-based practice. So that will help all of our individuals reach successful transition. And what we're focusing on as well is really that entire list, and this is by no means going to be everything, but it is a very comprehensive beginning for someone who is preparing for adulthood and transition into adult life, so that we can make sure they are going to reach at least, the highest level of independence and success that they can with our supports. My name is Michelle LaMarche. I'm a behavior analyst. I'm with Special Learning and Step by Step Academy, a center for students and adults with autism. And so let's get started. Upon completion of today's presentation, you should be able to at least walk away with 3 particular skills in your own repertoire. Number 1, identify the crucial skills needed, and we'll call those the crucial life skills needed to function independently in society. Number 2, learn ways to identify individuals' learning rate and style. We talked a little bit about that in Transition Survival 101, but we'll mention it again today and get into a few more specifics, as well as how that affects transition planning and the learning of those crucial skills. Number 3, we will list several evidence-based programs and strategies that are commonly used and successfully used to teach transition-related skills for our adolescent and adult population. Some things to be aware of before we really get into exactly what we want to talk about today is the literature is really spending a lot of time now. We're getting more and more resources and information and studies that are being done to assess what's going on in the adult population for those with autism, Asperger's, and PDD-NOS. How much access do they have to services, to opportunities to participate in the community, and also, what is their living arrangement? What we've found so far is that actually isolation will deepen once we move into adulthood, meaning the less opportunities that they have and the less often that we are creating those and, trying to make sure that they have lots of, valuable things to do during their days, tends to be that then they start to isolate, and they're, I guess really what you look at is the criteria that actually led them to get the diagnosis. Those particular areas can sometimes get worse, especially in the social and the behavior components and even the communication. If they don't have a chance to practice it, then it only makes sense that they're going to use it less and less. And that creates sort of this vicious cycle of isolation that gets greater and greater as they get older. So it's important to recognize that in the beginning, we really need to establish services and opportunities, but also try to maintain them throughout their life. In addition, competence correlates directly with self-confidence and self-esteem. Also, we need to create opportunities for individual choice. When we're talking about really any individual, and this doesn't necessarily matter for age, especially in our practice, the more opportunity we can offer for choice, the more likely they will feel that they have power and control, and that will give them, other options and strategies to use when things aren't going their way, or when they're told no later on, or they find out that they can't do a particular activity that they may be interested in at that moment because they have to complete something else first. In addition, it's one of the first skills that somebody should have in order to learn how to self-monitor their own behavior. So creating opportunities for the individual to make choices is going to, number 1, increase independence. It will also increase a sense of control and self-worth, as well as build their confidence and give them other strategies that they can employ as replacement behaviors in lieu of possibly challenging or maladaptive and problem behaviors when they can't get what they need in that moment or what they want in that moment.